again. Now, while the continent, the African continent, has so far been spared high concentrations of COVID-19 cases in communities, we're starting to see a shift. Infections on the continent have already surpassed that 1 million mark. Cases are standing over that figure. Let's speak now to Mr. Edwin Ikhuoria. He is available from One Africa to talk to us about some of the threats and challenges that we are seeing, but also the opportunities that we can leverage off going forward. Thank you very much for your time this afternoon. Let's start with the economic impact that we know, no doubt, has devastated many parts of the continent.
Yes, thank you for having me. And I think the most important part of this pandemic, the most important effect or impact on the African continent has been the economic impact, particularly because of the lockdowns that started initially with the informal sector, badly affected, and then going on to the global supply chains that have closed up across the countries, where you're not able to import or export at this point because of the pandemic. The fiscal situation for most African countries has really become really grim, in the sense that import duties have almost vanished. For commodity-based countries, the price of commodities have really dropped, and so getting resources for government has become a real difficulty. And the little they get, again, most African countries have been using this to pay external debt. And so that is why it is really it's an impossible situation right now for many African countries.
And of course, this impacts on the everyday citizen, with remittances also between countries taking a dip.
Of course. I mean, you can remit when you already survived and when you have a little excess. So for all the diaspora and African diaspora that's sending money back home, again, look at the level of unemployment in the U.S. alone. Look at the level of number of people who have lost their jobs. On the African continent, there's a lot of internal migration within Africa as well. Look at the number of people who have lost their jobs. Those in the tourism sector who have lost their jobs, there's no way they'll be able to. They cannot even survive, not talk about sending money back home, And so remittances have dropped. People have lost their jobs. Millions of people have lost their jobs. And then on top of that, talk about the food security threats. It's interesting you to know that Africa still imports a large portion of the food it consumes. And then with the low cost in East Africa, with the floods that came at some point, with the droughts again, it just became an impossible situation, for many African countries, for many African citizens.
That being the most curious situation, that we find ourselves importing what it is that we have in more than, abundance. Let's talk about health. I mean, already we had very fragile health systems before this pandemic hit us.
Exactly.
Is this not an opportunity, perhaps, to ready ourselves for what may come in the future and strengthen and tighten those healthcare systems?
Yeah, thank you very much. I think one of the things that we've learned from this whole process is that there is no economy if the people are not healthy. That is one key lesson here. So before now, there has been several advocacy efforts to try to tell the government, African government, to invest in the health systems, to invest in the health sector, to reduce maternal mortality and all of that, to reduce the HIV transmission or prevent mother-to-child transmission. These advocacies have been going on for years. But when the pandemic showed up, the government are suddenly realizing the connection between economic growth and the health systems. And right now it's an opportunity really now for the investment, the right investment to be made into the public health sector, so that, if we improve the resilience of the health systems, then against future pandemics or future outbreaks, because there will be outbreaks after all. Ebola just, in 2014, still continued in the DRC up till just recently, and then now there is the COVID-19. So pandemics will always come. So the more we invest in our health system to strengthen the health system to be able to absorb this kind of shocks, as well as not kill poor people, because if poor people are sick, they will spend everything they have on trying to get well, and that just keeps them further in poverty. And so I think it's an opportunity for us to really make that investment that we've been talking about for many years.
But we are bedeviled as a continent by corruption, right? So it's almost like a bucket with holes in it, and the more we try to fill the water, the more the water just keeps spilling out. We also have an issue of having to pay back debt that we keep getting. Nigeria spending 99% of its budget on debt service in the first quarter of 2020.
Yes. So I mean, like I said, we have been dealing with a lot of things, but I also think that it's an opportunity to rethink the way governance happens on the African continent. It is no longer just, lip service, paying lip service. The time for lip service is really over. Otherwise, real people will die, and people are dying right now, as we can see. So in terms of corruption, I think the most important, the antidote to corruption is transparency. So we're talking about the debt situation, for instance. Many African countries borrowed money that the citizens are not even aware of what the monies were used for, but the countries have to still pay back. And now, for commodity-dependent countries like Nigeria, with a huge debt burden that is taken to build infrastructure, as soon as oil prices go down, then they're not able to pay back. So like the example you made in the first quarter of 2020, what we saw was that with the drop in the volume of oil sales, with the drop in the oil price, the total revenues that was accruing to the federal government, about 92% was used to pay debts, both external and domestic debts. And that itself it just shows you how unsustainable this is. So this is a time to begin to even rethink how we raise capital, how we raise money to fund our infrastructural deficits, across the world. But as we're discussing this, I must say that Africa didn't cause these problems that we're seeing today. It's an external shock. The pandemic, nobody was preparing for it, and nobody can be prepared for it. Look at the US, for instance. Trillions of dollars have been injected into the system to sustain people in jobs. But Africans cannot afford that because there is no reserve anywhere to do that. And as such, because this is an external shock, that is the reason why we are calling for external parties to support the African continent by giving them the time, the leverage, giving them the space to be able to, attend to the problems that are on ground while they suspend debt repayment for now. And that's what we've been calling for, because without that happening, it's really difficult to get Africa out of this, straits.
For how long can we continue like that, though? I think as a continent, we have everything that we need, our most precious resource being the young population on the continent, which is oftentimes very frustrated. So you also experience a brain drain where people say, well, there are no opportunities for me here, so why should I even stick around? Is the time for getting external aid not perhaps over, where we need to suspend that and we look within and we actually pay more attention to what it is that we have been doing that has not been working for us?
Okay, thank you very much. This is a very hot topic. What you've just raised is a very hot topic in terms of development discourse. I will tell you something. So there is the ideal, and then there is the reality. Then there is the pragmatism, right? The ideal would be that we all come back, use our resources, develop our country, our continent by ourselves with our own resources. But the reality is that we have a history. There has been many years of de-development. Let me put that word. There have been many years of a system that has been built over many years where natural resources leave Africa, and then we import finished goods. And this has gone on for many years. So it has really put us in a place where we are structurally disadvantaged. And so the help that we get from external sources is not charity. It's actually important, really, because we need a partnership. If you look at the development goals, that's what we call a global partnership for development. That is very, very important. While Africa will continue to look for African solutions for African problems and the reforms that need to happen, the help that comes from outside is also very important to stimulate, especially when the market does not allow for the kind of investment we need to make. I tell you something, for instance. Where is the money that the Nigerian government is going to put in the health sector when it can't even pay its salaries or pay its workers, right? And so the question is that when you find yourself in such a situation, look at South Africa, for instance, with the high level of unemployment that is there among the young people. True, opportunities are scarce. So then there's need for an incentive. There's need for, an injection somehow to stimulate. And this cannot come from the sky. Right? So we have to work in partnership. There is what we must do as Africans and what we must do with our own resources and our own people. And then there is the help that must come, because we cannot even live in an isolated world. And so we are very grateful for the move toward the African Continental Free Trade Area. We tend to improve trade within African countries. We hope that itself can generate a lot of jobs and a lot of opportunities and make Africans trade with each other, which itself can result in major development. We're really hoping that takes off concretely. But as we're doing all of that, we need the cooperation of the whole world. We cannot be in isolation. Even the China example that has been made many years is that when China invested in itself and developed its people, it still needed the world to trade with. Otherwise, they get stuck as well. So I would say it is time for partnership. Aid has its place. Domestic resource mobilization has its place. Domestic governance reforms have its place. But all of these things must work together to get Africa out of the current situation that we are in.
Absolutely. Thank you very much for your time this afternoon. I think it was Professor Lumumba who said that we cannot afford to get despondent and in a perpetual state of complaining. Something must eventually give.